Welcome to Graper Harper Cosmetic Surgery. I'm Dr. Evon Zoog. Today, I'm going to walk you through your consent form for breast augmentation surgery with silicone gel-filled implants. If you have any questions while reviewing this form, please enter them in the portal below or feel free to ask them in person if you prefer. First, I want to explain what this procedure is meant to do. Breast augmentation is a procedure designed to increase breast volume and enhance shape using implants. Patients may choose this surgery for different reasons, including wanting fuller breasts, restoring volume after pregnancy, improving balance if one side is smaller than the other, or replacing older implants. My goal is to help create a result that fits your body and your goals as naturally as possible, while also making sure you understand the long-term responsibilities that come with implants. Next, let me walk you through how the surgery is generally performed. During this procedure, I place a silicone implant through a carefully chosen incision, usually in a location that helps keep the scar as discreet as possible. In a subglandular augmentation, the implant is placed behind the breast tissue and in front of the chest muscle. The exact implant size, shape, and surgical plan are based on your anatomy, your preferences, and what I believe will give you the safest and most balanced result. If there is loose skin or a lower breast position, some patients may also need a lift to achieve the shape they are hoping for. Before moving forward, I want to review the big picture in a clear and balanced way. This procedure can offer fuller volume, improved balance, and a shape that feels more in line with your goals. At the same time, it is still surgery, so there are real risks to understand. These can include bleeding, infection, fluid buildup, scarring, pain, swelling, changes in nipple or skin sensation, asymmetry, delayed healing, implant movement, the possibility of needing more surgery in the future, and other unforeseeable complications that I cannot predict. Alternatives include choosing not to have surgery, using external padding or prostheses, choosing saline implants instead of silicone implants, or in some cases, using your own tissue rather than an implant. No treatment is always an option as well. I also want to spend a moment on implant rupture. Like any medical device, an implant can eventually fail. If a silicone implant ruptures, the silicone often stays within the scar tissue around the implant, which is why some ruptures cause no obvious symptoms at first. That is often called a silent rupture. In other cases, you may notice changes such as a change in shape, firmness, swelling, tenderness, burning, numbness, or lumps. Ruptured implants cannot be repaired, so if a rupture is confirmed, removal or replacement is usually recommended. The longer an implant has been in place, the greater the chance that rupture can happen over time. Now, let's go over capsular contracture, or CapCon for short. After an implant is placed, your body naturally forms a layer of scar tissue around it. In some patients, that scar tissue tightens more than expected. When that happens, the breast may start to feel firmer, look rounder, sit differently, or become uncomfortable. This can happen early or years later, and it may affect one side, both sides, or not happen at all. If it becomes significant, treatment may involve surgery, implant replacement, or implant removal, and even after treatment, it can still come back. I also want to review two other topics, ALCL and rippling. Breast implant-associated anaplastic large cell lymphoma, often called ALCL, is not breast cancer. It is a rare cancer of the immune system that develops in the fluid or scar tissue around an implant, and it has been reported more often in patients with textured implants than in those with smooth implants. Symptoms can include ongoing swelling, a mass, pain, or other changes around the implant, often years after surgery, and those symptoms should be evaluated promptly. Rippling is different. Rippling refers to visible or felt wrinkling of the implant or the overlying breast tissue. It can happen with implants and may be more noticeable in thinner tissue, but it is not the same thing as lymphoma. One common question is how often breast implants need to be exchanged. Breast implants are not lifetime devices, which means they should be expected to need monitoring and at some point, possible removal or replacement. Even if you feel well and everything seems normal, The FDA recommends screening silicone implants for silent rupture with ultrasound or MRI, starting about 5 to 6 years after the initial surgery, and then every 2 to 3 years after that. If you ever have symptoms or an unclear ultrasound result, MRI is recommended. It is also important to let your mammography team know that you have implants, because implants can make breast imaging more complex, and special views may be needed. Before you finish, I want to bring everything together clearly. By signing this form, you are confirming that we have reviewed the purpose of breast augmentation, the possible benefits, the risks, the alternatives, and the long-term responsibilities that come with implants. You understand that implants are not lifetime devices, that future monitoring and possible replacement or removal may be needed, and that no surgery can guarantee perfect symmetry or a permanent result. You are also acknowledging that following your post-op instructions carefully is an important part of your healing and outcome. My goal is for you to feel informed, comfortable, and confident in your decision. You can now sign this form by scrolling down to the bottom. Please enter any required initials, dates, and signatures requested. You will be emailed a copy of this form as soon as you submit, and the office will receive a copy as well. Thank you, and we look forward to taking care of you.